મારે તો ખાલી પડે નાની નાન બગલીને નાના એવા સપનાની રેત વાળી ડગલીને તોફાનો તરાપ મારે હાલે સાવ આપી જાય તોય જેની હિંમત અને આમ નહીં આપે એવો ખારનો ખલાસી એવો આગનો પ્રવાસી એવો ખારનો ખલાસી એવો આગનો પ્રવાસી ગોતીલો 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 ગોતીલો
પોતાના જ દરિયામાં પોતાની જ ડૂબકીથી જાતનું અમૂલ મોતીલો
ગોતી જે મજામાં ખાલી વાવટા ધજામાં એવો આગનો પ્રવાસી ગોતીલો
बाजे रे ढोल बाजे बाजे रे ढोली तारो ढोल बाजे ढोल बाजे ढोल बाजे ढोल के ढम ढम बाजे ढोल
के ढोली तारो ढोल बाजे ढोल बाजे ढोल बाजे
छोरी बड़ी अनमोल मीठे मीठे इसके बोल आंखें इसकी गोल 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 तो ढम ढम बाजे ढोल
हाँ हाँ छोरा है नटखट बोले है पटपट कर छेड़े तुझे बोले ऐसे बोल तो ढम ढम बाजे ढोल
है रमती आवे माड़ी रमती आवे मेलडी माड़ी आज रमती आवे
It was such an energetic dance. મજા આવી ને બધાને? ગુજરાતમાં કોલેજ હોય અને ગરબા ના થાય એવું તો બને જ નહીં.
Now, as the environment is filled again with energies, we request Dr. Ashok Kumar Das sir to please come on the dais.
Good afternoon to everybody. I am the last batsman of today's innings. Let us see what I can offer to you. At the outset, I must congratulate the organizer of this program to invite me to share my experience and understanding before you. Without wasting much time on the introduction, I would like to enter into the subject. Let us start with the first aphorism of organon of medicine. As you all know, the physician's high and only mission is to restore the sick to health, as it is termed. Next slide. It's not working. It's not working. Dr. Kalpit told me that we must teach the students so that they can practice homeopathy. So what is the aim of homeopathic teaching? To produce the physician who can practice homeopathy with confidence, keeping in mind its scope and limitations. Please, you must be aware that homeopathy has a great scope to treat different diseases, but at the same time, you must be well aware of its limitations. We have to work within our scope, but at the same time, we want to encroach whatever limitations we have by continuous research works. So, as a homeopathic physician, we must know our scope and limitations, and through homeopathic research, we'll try to overcome such limitations so that we can serve to the suffering humanity at the present context. The roadmap of homeopathic understanding, it is to transform the theory to practice. The eyes cannot see what the mind does not know. That's why, if you go through the curriculum of BHMS starting from the beginning, the first 1 and 2 years is related to physiology and anatomy. The physiology deals with the study of normal function of the human body. The anatomy deals with the study of structural component of the human body. Then third year onwards, you will be exposed to pathology, which deals with the disease process. How a normal person becomes diseased in the process that you learned through pathology. Now this pathology Hello? Is it audible?
Hello.
This is audible. Now in the third year onwards, you go to study pathology. Pathology is nothing but to understand the disease process. Now this pathology is related to the modern medicine. And then you will be exposed to the practice of medicine, which deals with the different signs and symptoms of the disease and your diagnosis, your differential diagnosis. And after that, you need to study homeopathy. So in homeopathy, you need to learn all the allied subjects, starting from anatomy, physiology, pathology, and all allied subjects. And that knowledge is to be applied in the treatment of different diseases through homeopathy. So you must have an equal knowledge of all those allied subjects in order to practice homeopathy. I will come later on that how that knowledge can be applied in the field of homeopathic therapeutics. Next, that's why I'm talking, you need to transform the theory to practice. Until and unless your theoretical understanding is very clear-cut, you will not be able to put in practice. I used to say, or it is the one saying, the eyes cannot see what the mind does not know. So theoretical understanding is very, very important for your success so that you can apply that knowledge in therapeutic field. That is transforming the theoretical knowledge to the practical knowledge. Homeopathic education system, if you see any education system, homeopathy is not an exception. It needs, one, the first teacher, two, the student, three, the patient, both in OPD and IPD, and you need an academic environment. Until and unless there is a good interaction of all these four components in an education system, your learning will not be complete. Now you see, here I saw the teacher and students. I give lecture, and it has no impact on your mind. It is fruitless teaching. As we have done earlier in the traditional mode of teaching, where usually the teachers teaches and students learns something or not. When the examination comes, we always search for, sir, give me them suggestion, and suggestion. And we prepare certain questions, memorize, put in your answer scripts, and you pass. But there is no understanding of the subject. In the earlier session, Dr. Parveen told that mere discussion on swimming will not allow you that you can understand or you can swim in the pond. So you need to practice. So practice is very, very important in homeopathy, not only in homeopathy, in all professional education system, you need practical teaching. I also used to say that whatever you learn in your 4th year or 4 or 5 years classes or in your post-graduation, everything have certain importance in your practice life. So there is no important questions, no important subject to be learned. You need to learn each and every subject from beginning to end, because the patient will not come according to your syllabus which you have read. I used to say that each of your patient will be your examiner. You have to give the exam before each patient at each time. So be prepared for that. Last time someone is raising that what is the future of homeopathic students? My question is, I will discuss that part. That if you equip yourself to practice homeopathy, you will get everything. Name, fame, money, everything. But you must be very sincere to understand this one. Another thing I want to emphasize, that learning is a reciprocal phenomena. It is a bilateral phenomena. I will say something, you will interact. Then and then, it will give confidence to you. That's why if there is some teachers, I always say, not only group discussion, let them give one subject to each student to teach. Even myself, today also learning from teaching. Whenever I go to the different seminars, both at an international and national level, many audience students raise questions so that I can also think over it. And also one request to all the teachers here present. As a teacher, I may not learn each and every part of the subject in the medicine. If I do not know, don't give bluff. Study it. Next day, you can give the answer. So that is very, very important. Not only that, I have the experience to have the teaching process in the medicine in different countries like Australia, UK. I have seen they have only 3 theoretical classes, 3 days theoretical, 2 days clinics, first 2 years. The next 2 years, there are 4 days of clinics, 2 days of theory. Because I want to show you that teaching, as I told you, the active participation of a student is must, for which the teacher should create interest in the subject. Please keep in mind, sometimes say, homeopathy, especially organon, is a dry subject. No. If you study organon, I can show you that how far it is scientific, what is the interest behind. Because the whole of homeopathy depends on homeopathic organon of medicine and philosophy. Please keep in mind that there should not be any discrimination of organon, materia medica, and repertory. Because to treat a person homeopathically, we need the help of all the 3 subjects equally. Because you know how to use a medicine. Medicinal knowledge will come from materia medica. How to use it, that comes from the knowledge of your organon medicine. And how to search out a medicine out of so many different medicines, you need the help of repertory. So it is a wrong approach. I used to say that MD in organon, MD in materia medica, MD in other subjects, specific subjects, is not a futile efforts on our part, because as a physician, we need to have an equal knowledge of organon medicine, materia medica, and repertory. As you used to say, that if you want to learn a language, you know the language, you need to know the grammar, you know the dictionary. To learn a language, 3 things are essential. 1, there should be a language. 2, there must be certain grammar to follow. And the 3rd is, there must be some dictionary. In homeopathy, the language of disease are nothing but the symptoms. And that is written in our homeopathic materia medica. The organon is the grammar. And repertory is nothing but a dictionary. So to learn homeopathy, we need the help of all the 3 subjects equally. Now, teaching is an art. I told you perhaps that how to teach. There may be so many different modes of treatment, teaching, audiovisual, class, these, that. But during our time, when Dubé was the teacher of myself, he taught a medicine. And I still remember. Even I have seen that what medicine I missed someday, not taught by Dr. Dubé or others, I will still try to learn that medicine. So his teaching, that I must impress you such a way so that you can retain in your memory. So as a teacher, our target is to create interest in the subject so that the student automatically go and delve within the subject. And that is the duty of a good teacher. In this regard, I must quote the saying of Dr. William Osler, considered as the father of the modern medicine. And according to him, medicine is learned by the bedside and not in the classroom. It is a word long before. He was a Canadian allopathic doctor. He is considered as the father of the modern medicine, but it is still applicable. That's why I quote his words. Another thing you must keep in memory, that homeopathy should be learned much more on bedside. Why? First of all, you know that homeopathy is individualized mode of treatment. And for that individualization, you need to diagnose the disease, but at the same time, you need to individualize the patient. To an allopathic physician, mere diagnosis of the disease is sufficient because they have specific medicine on the basis of the specific name of the disease. A patient suffering from pneumonia, mere diagnosis of pneumonia is sufficient for them to prescribe. But as a homeopathic physician, we need to individualize the case. As at the morning section, Dr. Parveen Ji, he speaks about the importance of anatomy. In case of us, we have to know whether the right lobe is involved, whether the left lobe is involved, whether the right upper lobe, middle lobe, or lower lobe, or left upper, left middle lobe is involved. Because we have certain medicine having some specific affinity to that particular lobe. So we must be much more specific. That's why mere diagnosis of the disease may be the target of allopathic physician, but after that, we have to individualize the case. And for that individualization, we must have an equal knowledge of allied subjects like anatomy, physiology, practice of medicine, and not only that, we must take the opportunity to take the advantage of all the modern technological development, the development in the field of biochemistry, the development in the field of serology, the development in the field of immunology, so that we can put in practice all those concepts without compromising the basic principles of homeopathy. So perhaps you've seen that many of the successful homeopathic practitioners was earlier an allopathic physician, because they know the disease and at the same time they know the homeopathy. Now, your syllabus is equal to allopathic physician, so you must try to learn those all subjects and apply it in homeopathy without compromising the basic principles of homeopathy. Now, with this brief introduction, so emphasis on clinical teaching or bedside teaching is the need of the time to produce homeopathic physician who is confident to practice homeopathy competently. I use the word because, why? Because what is the competence? Now you are all talking about competent-based dynamic curriculum. Competence, as defined by the Robert A. Rowe in the year 2001, competence is defined as the ability to adequately perform a task, duty, or role. That means you must have the confidence to practice. You must have the ability to practice with confidence as a homeopathic physician to cure a patient as written by Dr. Hahnemann. So this is our target. What qualities of a teacher? A teacher should be sincere. A teacher should be love and devotion to homeopathy. Please keep in mind, love to homeopathy is very, very important. Until and unless you love homeopathy, you cannot get anything. So first thing, is love for homeopathy. And to create love for homeopathy, in the initial stage, as the teacher said, Dr. Join, the fundamental course, the teachers, they will show you that this is the homeopathy, and you come and see the result, and you develop yourself. I have seen you during my time also. 50 students, they got admitted, 10, they go away. But the most formative period at the initial stage to stick student in our homeopathy is the first year, so that we can show the efficiency of homeopathy. Even for myself, just I will give you my example. Initially, I was a good academic career, leave it. Then whether I will study homeopathy or not, one of my friends, he told, yes, there is an advertisement, you just go through and apply.
Mike Nazdik.
But according to that time, my age was one day above, because I passed BSc Physiology Honours during that time. So I think that I will not be selected why to go through. But I see that my name was at last in the Calcutta Homeopathic Medical College, and then I got admitted. But after going to the college, I developed love for homeopathy. And that ultimately leads to this present stage. Many of my friends I have seen, they go to other, even some friends, they are now going to the, doing surgery and this and that. But I am very much proud that I am being a homeopath. I'll give my experience at my last time. I'm going to develop on a hospital, 100-bedded hospital, where there will be all types of treatment will be there, allopathy, homeopathy. This is an hospital. And when I begin to start the construction, lot of problems, because in Calcutta, there's a group of mafia that demand money whenever you do want something. So I convinced them that this is not my purpose, is to serve the society. The MLA called me, I told him, you send me 10 patients, I will treat them without any money. But don't say that you take all those things from these, that. I convinced him, and he was convinced. And you will not believe, this is a most complicated area to do construction. But there is no problem of constructing that, because after some days, his mother's got certain treatment, suffered from cancer. And that cancer at the age of 78. And they told, at this stage, radiation, chemotherapy is not advisable. Let them, whatever you go, because sometimes some friends are there, they told them, let us do some homeopathy. So he comes to me, and I'm treating till date, and he helped me to develop my hospital. So what I told you, that if I am not a homeopath, I will not be able to construct that hospital. So you have a great advantage that you come to this particular subject, but you need certain devotion to learn the subject. It is not so very easy. Easy means sometimes easy, sometimes difficult. Sometimes easy. So if you learn homeopathic subject, my target is to make the homeopathic practice very simple. Please, first try to learn how to treat an acute case, then go for some chronic case, then ultimately go for treatment of cancer and other complicated cases. So your journey will be from below upwards. The knowledge should be like of a pyramid. You know more than me, CBDC, so many things. So with this background, I will not say much. Teachers need to be a role model. During our time, we used to attend our teachers, Dr. Dubey, Dr. Pishipal, they are our role model. Yes, so that's why a teacher try to be a role model to the students so that the students can follow you. Next. So now I am coming to the specific subject because much I have said, this is everything of you know. Application of knowledge of miasm in clinical practice. In fact, for the time being, to understand miasm, it may take a lot of time to discuss. I will give a bird's eye view of this concept so that you can easily understand my next presentation. Initially, when Dr. Hahnemann practiced homeopathy, he used to prescribe on the basis of the present symptoms. What was his observation? His observation was that in case of acute diseases, he cured completely. But in case of chronic diseases, the symptoms recur after some time, which may be weeks, months, or years, in the same form or some different form. So that failure to cure chronic diseases while able to cure acute diseases led several questions in his mind. What he did, he retrospectively studied the different failure cases. And what was his observation? That in a particular group of cases where there was history of suppression of the skin disease leads to the development of a group of symptoms. Another group of cases where there was a history of suppression of syphilis by some treatment of dissimilar means leads to another type of group of symptoms. And the last one, that suppression of gonorrhea leads to the development of another group of symptoms. This strikes in his mind that this suppression of skin disease, the suppression of gonorrhea, the suppression of syphilis leads to pollute the whole organism so that it leads to development of that type of disease. And that's why he told that whatever I am prescribing on the basis of the present symptoms is not the true totality of the symptoms. The symptoms which develops following the suppression of this skin disease through the different years leading to the development of the present is to be considered the whole totality for our prescription. So these present symptoms are nothing but the end result of a disease process which has started after the suppression of the skin disease, after the suppression of the gonorrhea, or after the suppression of syphilis. So if you consider the totality, you have to consider the whole disease from beginning to the end. That's why if you go to the organon, he initially says that the medicine is to be prescribed on the basis of the totality of the symptoms. But what is the cause behind totality? The miasm. That miasm also to be considered to cure a chronic case completely. That's why you have to take the totality of the symptoms, but at the same time, in chronic cases, you have also to consider the miasm so that you can cure the case completely. So please keep in mind, many of the students used to say that if we take all the symptoms, that is means miasm to some extent, but what is the cause behind? And the consideration of the suppression, consideration of other things, that is also important. In fact, a few days back, I'm taking classes to Lucknow College. I take 10 hours for different days, beginning the understanding of the basics of homeomiasm and how to apply that. Today, I'm just giving that idea that how we are applying that concept in the treatment of different chronic diseases. Now, in my presentation, I first started with a very simple case. If the time permits, I'll go to the next stage where the different important cases or palliative, how we are doing brain tumor, other cases. But most of the cases, you see in your outdoor, they're very simple cases. So first you try to learn how to treat by homeopathy all those simple cases. Be practiced for 1 year, 2 years, 3 years. Then gradually, you develop your own idea how to treat all those things. I does not mean that you will not treat chronic cases, no. Initially, first year, second year, third year, how to take the case, go on gradually so that you get much confidence in practice. A case of eczema, very simple case. Abhinav Sahu, residing in Kasbah, consulted me on that. What is this problem? Eczematous rashes on both palm with scaling and cracking with soreness of for 1.5 years. Rashes on different parts of the body with severe itching and burning followed after scratching, skin dry. Now you see the appearance of that skin of the patient. You see, the rashes on different parts. What's the past history? Treated by various ointments following the advice of different dermatologists. High triglyceride level, history of tuberculosis, family history, nothing significant. Generalities, appetite good, stool regular, twice daily, waking from sleep, sweat profuse, sleep good, but snoring, sleeps with open mouth, desire for sweet, warm food, cold drinks, aversion, nothing particular, hot patient. First, the miasmatic analysis, the eczematous rashes with scaling and cracking with soreness. This indicates psora. Rashes with severe itching and burning followed by scratching, that is psora. Skin dry, psora. Next, history of suppression of skin disease, that is psora. In this regard, I must also mention that after the diagnosis of the disease, we also need to have miasmatic diagnosis for the treatment of chronic diseases. What's the miasmatic diagnosis? The psoric eczema. What's the totality of symptoms? Suppression of the skin disease, hot patient, desire for sweat, stool waking from sleep, severe itching and burning follows after scratching, skin dry. As regards totality of the symptoms, I must mention that what do you mean by the totality? Now, after taking a case, you analyze all the symptoms, and there are some symptoms are common to the disease, and some symptoms which indicates the individuality of the patient. Dr. Stuart Close very rightly and very easily divided this totality of the symptoms into two. One is the diagnostic totality. The totality on the basis of the common symptoms by which you can say that this is a case of tuberculosis. This is a case of cancer. This is a case of meningitis. And that diagnosis of disease is very important in homeopathic practice also. The time is limited, it's just I'll give. A patient is suffering from diabetes mellitus. So you need to restrict the calorie along with your homeopathic constitutional drugs. A patient is suffering from chronic kidney disease. You need to restrict the protein. A patient is suffering from gout. You need to restrict the purine-rich protein until and unless you only see that, oh, he is suffering from pain joints. No. So that will help you for the diet. The second, the auxiliary management. Another very important one. I told you that the scope and limitations. The prognosis of a case. Suppose a child comes to you, the mother comes to you, the doctor, he is not able to swallow. You just check the throat, both the tonsils are very much red, inflamed, and you give the homeopathic medicine, it will cure. Another patient, aged 65 years, doctor, I have some problem in swallowing some food. Now, if you think of that, what is the cause? You will give certain medicine and it will be cured. But you know that CA esophagus may be the cause for the difficulty in deglutition. And you say the prognosis is totally different in both cases. A patient comes to you with jaundice, where there is increased bilirubin level. Now you know that bilirubin jaundice may be of different types. It may be hemolytic, it may be obstructive, it may be hepatocellular. So only if you think of, oh, there is yellow discoloration, we will give this medicine, it will cure. No, it is a case of obstructive jaundice. If it is due to the cancer, CA pancreas, head of the pancreas, by giving chelidonium, by giving any other medicine, it will not immediately cure. So the prognosis of the case can be learned by proper diagnosis. And you need to take the help of all those things which is available at the present time in the medical science. You must have a equal knowledge regarding practice of medicine so that you can successfully homeopathically practice. Now, what I want to say you, the totality of the symptoms. I told you this is the diagnostic totality. Another one is therapeutic totality. That means the uncommon peculiar symptoms which both the earlier speaker says that you need to find out the uncommonness so that you can individualize the case. And that is the therapeutic totality. You see, very common, you see, very good example given by Dr. Stuart Close. Suppose there is one machine, or I can give the one example of computer. In a computer, so many parts. Now, so many parts, if not assembled in a definite fashion, it will not work. Likewise, in homeopathy, after case taking, you may get lot of fragments of symptoms of different symptoms, but you have to assemble in such a fashion so that in one way, on the basis of the common symptoms, you can diagnose the disease. And on the other hand, by knowing the uncommon symptoms of the patient, you can get the therapeutic totality. So this whole totality, it constitutes the image of the patient, the portrait of the disease. So please, nothing is very difficult to understand the whole thing. So here I have seen, we have done the totality of the symptoms from therapeutic totality, the suppression of the skin disease, the hot patient, desire for sweat, stool waking from sleep, severe itching, burning follows after scratching, skin dry. The miasmatic totality, miasm shura, suppression of the skin disease, hot patient, desire for sweat, stool waking from sleep, severe itching and burning follows after scratching, skin dry. All of them know the medicine. What's the medicine? Yes. So if you go in this way, you can also like me, also more than me. So it is very simple. Only the thinking should be logical, following certain basic principles. Then you will easy to understand how to prescribe a homeopathic medicine. Yes, you have seen the same thing. But if I only send you the patient, you may not get it because you have to learn it, that how to take the case, what are the symptoms to be emphasized. But if I go the totality, then it will be easy. Treatment, sulfur 0/1, 50 millicent, because we have some experience in our time. Dr. Principal, myself, he has given sulfur 200. I suffered about 6 months. I have to admit in the hospital. Anyhow, I used to give sulfur always in 50 millicent potency. We have given 16 doses. Allergy profile through ELISA method. Now I am show you how to integrate the knowledge of the present pathology to homeopathic practice. Now you see, if you go through pathology, the eczema may be one of the causes atopic due to allergy. Now there is a method by which you can, to some extent, know the allergens. In our environment, there may be thousands of allergens. But to some extent, there is a method of ELISA method to know to which the person is allergic. So I advised allergy profile through ELISA method. Why? Because you know from organon medicine that in case of presence of a maintaining cause, in spite of giving your indicated medicine, it will not work. You have to give indicated homeopathic medicine, but at the same time, you have to avoid the maintaining cause. Because if you are allergic to tomato and you are going to consume the tomato, it will act as a maintaining cause. That's why allergic profile through ELISA method. Why 50 milliliter potency? Please try to understand. Each of an action of homeopathy must have a logic behind. Why I am giving this medicine, why I am giving this potency, why I am doing that, everything must be logical, based on homeopathic philosophy. In this regard, I also want to just discuss what is philosophy. You see, we are talking in the pagan science of Day of Science. What is the need of philosophy? Please, just to understand, the highest degree in education system is PhD. What is that PhD? Doctor of Philosophy. Whether you are in physics, chemistry, biochemistry, arts, science, where science ends, philosophy begins. Please keep in mind, where science ends, philosophy begins. Many of the things in this universe cannot be explained on the basis of the science, modern knowledge of the science. But still it is a fact. All the scientists of the different sciences tries to correlate all those things to understand this universal phenomena, and that is philosophy. That's why the highest degree in the field of science or arts or any subject is philosophy. So philosophy and homeopathic philosophy, that will take another more time. So just for interest, I'm talking that why we need to understand philosophy. Why 50 milliliter potency? To avoid severe homeopathic aggravation, as there is a history of suppression of the skin disease. What we observed, that after giving homeopathic indicated medicine, if there is history of suppression of skin disease, there may be coming out of the old symptoms. That's why if you give 50 milliliter potency, the chance of severity of homeopathic aggravation will be less. What is the basis of prescription? That I have already told you, but at the same time, you see, I have included the miasmatic cause also. So not only the sulfur, but also it covers the miasm. Next, 954 sulfur 0/2. In this regard, I also point out regarding the repetition of doses. The repetition of doses in case of centesimal scale is totally opposite to 50 millisimal scale. In case of centesimal scale, if you give a certain potency, if the patient improves, so long the patient improves, you need not to prescribe any other medicine. You prescribe the second best remedy in our homeopathy, that is placebo. So it will take another 2 hours to discuss what to repeat. So for the time, just keep in mind that in case of use of centesimal scale, you need not to prescribe any other medicine so long the patient improves. But in case of 50 millisievert potency, what happens? If the patient improves, you go on giving in increasing potency, 0 by 1, 0 by 2, 0 by 3, and the homeopathic aggravation will come at last. So what to do during that time? Either you need to stop the medicine, or you can increase the gap in between so that that aggravation will ultimately go and it leads to cure. So whenever you are using 50 millisievert potency, be aware that even if the patient improves, you can go on giving increasing potency. In this relation, as I am mentioning what is homeopathic aggravation, as you are a student, you see, whenever you give a medicine, homeopathic medicine, in its primary action, it will produce the stronger similar disease. Now this stronger similar disease will permanently annihilate the natural disease according to the section 26, and the patient for the time being suffers from some slight intensification of existing symptoms, which we know as homeopathic aggravation. So homeopathic aggravation occurs due to the primary action of the medicine. As you all know, there are 2 types of action basically, the primary action and secondary action. The secondary action may be of again 2 types, the secondary curative action, secondary counteraction. In case of secondary curative action, as there is a similar relationship between the drug and the disease, the vital force remain in a passive state so that the disease, medicinal disease, will gradually and gradually decrease and the health will be restored. So secondary curative action occurs in case of homeopathic medication. Understand? But what about, because why I am talking other things, I want to teach you through this case the whole of homeopathy so that you can practice easily. You must have a theoretical background, and at the same time, you must have practical knowledge. Now, in case of antipathic mode of treatment, what happened? You give the medicine, for the time being, there will be palliation. Palliation means temporary relief of the symptoms. Again, as I use the word palliation, what is the difference between the word palliation and suppression? Palliation is the temporary relief of symptoms, and the disease remain in the same place. I am suffering from headache. I take certain analgesics, temporary relief of my headache, and next day I again suffer from headache. So the disease remain in the same state. But in case of suppression, what happened? You apply certain ointment on the skin disease disappeared, you developed brain tumor. Here, the disease has shifted from less important organ to the more important organ. So in case of palliation, the disease remains in the same place, but in the suppression, it affects the more vital organs with the disappearance of the skin lesion. So this is the basic difference between suppression and palliation. You see here, the patient has a history of skin disease, suppressed, leading to the development of eczema. So here, the disease process has shifted, and that is suppression. So you know, I think you have a very good idea about now palliation and suppression. So sulfur zero, yes, secondary curative action. In antipathic mode of treatment, the patient is suffering from constipation. They will give one laxative, okay? So laxative in its primary action will produce diarrhea, and patient will move regularly. If I withdraw the drug, there will be opposite reaction. There will be more constipation. In order to combat that more constipation, they used to give more doses of laxative. So they are going to increase the doses in the long process of treating a case of constipation. So what will happen? Due to the long continued use of certain dissimilar drugs, they will produce certain dissimilar disease. And that, when two dissimilar diseases meet together for a long time, they lead to the development of complex diseases. As you have seen in a case of treatment of rheumatoid arthritis, they used to give allopath steroids. Mere 5 milligram steroids, prednisolone, is sufficient to control. After 1 year, 2 years, 3 years, you see, they increase the dose of steroids. Then there develops different types of side effects. Increased blood pressure, increased sugar level, so many different types of symptoms. And the disease symptoms and drug symptoms, natural disease, they forms, as they are dissimilar in nature, they lead to the development of complex disease. So, and there is no cure. So, why there is no cure? You can palliate for the time being very easily, but there is no cure of antipathic treatment. In allopathy, most of the time, they use antipathic mode. Because, you know, to increase, to treat hypertension, they give a drug which reduces the pressure. Certain medicine, in case of the treatment of the diabetes, they give only to decrease the blood sugar level. If you use the drugs, there will be secondary counteraction, and it will be difficult to control. So, coming to my case presentation, itching better, scaling, cracking less, skin is becoming smooth, sulfur 0/3. Sorry. Follow-up, very important one. Follow-up is, you have to learn follow-up. Don't jump to prescribe haphazardly. Itching aggravates, that is homeopathic aggravation. What we give? Placebo. Next, no itching. Color and texture of skin of palm and other parts are normal. Please keep in mind. If you go through the organon of medicine and these chronic diseases, Hahnemann told, in the treatment of skin diseases, so long the skin contains, regains its normal texture and color. Please keep in mind, the texture and color, you cannot say that you have cured. So, as here, the texture and color is coming normal. You see now the appearance of the palm. Just listen, what is the experience about homeopathy? Please give the video.
मेरा नाम अविनाश है। 1.5 साल से मुझे ये स्किन इशू है, जिसका मैं डॉक्टर दास से मैं इसका ट्रीटमेंट करवा रहा हूँ। 1.5 साल पहले ये मेरे को फर्स्ट अपेयर हुआ था मेरे हाथ में, ठीक है। ये मेरे पाम्स में यहाँ पे मुझे ब्लिस्टर्स हो जाता था, मतलब ये ऐसा लगता था कि जैसे कोई कट हो गया है और बहुत पेन होता था। और मैंने डॉक्टर दास को दिखाने से पहले 3 एलोपैथी के डॉक्टर्स को दिखाया, जिससे मुझे उतना कोई फ़ायदा नहीं हुआ। मेन मेरा प्रॉब्लम था कि हाथ में ब्लिस्टर्स हो जाने के कारण बहुत पेन रहता था, पानी यूज़ नहीं कर सकता था, मैं कुछ यूज़ नहीं कर सकता था, सोप यूज़ नहीं कर सकता था, ठीक है। मगर होम्योपैथी में आने के बाद विदिन 1.5 मंथ्स मेरा ये तो ठीक हो गया, बट बहुत अलग अलग जगह में मुझे और भी है स्किन इशू, जैसे यहाँ पे है, इसमें है, थाइज में है, वो सारे मगर कंट्रोल में है। मतलब विदाउट होम्योपैथी मेरे को नहीं लग रहा था कि ये ठीक होगा, बट होम्योपैथी के ही कारण ये ठीक हो रहा है। ऑल थैंक्स टू डॉक्टर दास, वरना ये पता नहीं, मतलब बहुत पेनफुल था वो, बहुत पेनफुल अभी भी है, मतलब उतना ज़्यादा नहीं है अभी, 20% डिस्कम्फर्ट है जो 100% डिस्कम्फर्ट था पहले। अभी पता नहीं कितने दिन और लगना है इसको ठीक होने में, बट होपफुली ये जल्दी ठीक हो जाए। बट विदाउट होम्योपैथी तो ये ठीक नहीं हो पाता। आई गेस इसका एलोपैथी में कोई ट्रीटमेंट नहीं है, कोई प्रूवन ट्रीटमेंट नहीं है, बट होम्योपैथी तो मतलब इट्स लुकिंग गुड कि होम्योपैथी में शायद ये ठीक हो जाए जितना जल्दी हो पाए। थैंक यू।
Clap, it is your selected sulfur. So you also need clapping. It's nothing difficult. Just you think logically, you will get the answer. My purpose is show you how to practice homeopathically easily. Because I am a very simple man, I understand science from very simple way, so that you can practice. You see, it is not difficult to practice here. But at the same time, what I did along with sulfur, I advised to avoid all those foods which he is allergic. What is the logic? I want to remove the maintaining cause. So avoiding the maintaining cause along with sulfur did. The patient, actually during my teaching to Lucknow College, this is about 3 to 4 months back, I take this video from him. He's still almost, he's covered, completely recovered from the skin disease. Now he's suffering from some other problems like very acute cold and like that. But this is homeopathy. You can practice like me if you logically think over it. Next. A case of moles. Why I am giving small cases? Because every day it will come to you. I want not to discuss so much about what is moles, this and that. Only thing you can be aware that whenever you want to treat any growth, it may be benign or it may be cancerous. That as a physician you must keep in mind. Otherwise, if you go on treating a case of cancer, skin cancer, without knowing that this is a cancer, if you can't able to cure, it will go to the other physician and they'll show, doctor, his homeopathic physician is treating for 1 year. My treatment, the disease has increased. Don't give them that scope. Anything you try to diagnose, to know your scope and limitations. So most moles are benign. And another thing, if any mole or any growth, you see sudden change. If there are changes in a mole's color, thickness, size or shape, bleeding, oozing, itching, or become tender or painful, it needs immediate treatment and you must be very cautious. What are the important signs? The asymmetry. If one half of the mole does not match the other, if you see the difference. The border, if it is ragged, blurred and irregular. Color, if the color of the mole is not the same throughout, different in the different parts. Diameter, if it is larger than an eraser of a pencil. And the elevation or evolution, if the mole becomes raised after being flat or it changes over time. So any changes of any growth, you must be very cautious. Here is a case. Black cauliflower-like growth of the left side of the face with sudden increase in size, having itching, pain, and offensive reddish watery discharge for at least 3 months. Hard inconsistency. Please, yes, that is also important. What is the consistency of the growth? If it is very hard, it gives certain idea it may be a case of CA. Loose cough for the last 3 to 4 days after exposure to rain with profuse watery expectoration. Next, often suffers from heartburn, aggravation, fruits, stool 1 to 2 days interval, hard, history of recurrent cough and cold, aggravation, rheumatism, headache, occasional. Now you see the moles. You see the moles? History of the present complaints. A small, black, dry, soft swelling was present on left side of the face since early childhood. It is very gradually increasing size with increased age. About 3 months back, there was sudden increase of size of the swelling with itching, pain, and offensive reddish watery discharge. The mole was present since long time, but last 3 years undergone certain changes. She consulted allopathic physician who advised her to undergo immediate surgical removal of the growth followed by biopsy. So the patient consulted me to avoid surgery. Yes, this is most of the cases you will get in your clinical practice. They take help of homeopathy when some surgeons tell that to do certain surgery. So to avoid surgery, past history of migraine, headache, treated by allopathy, now occasional headache. Actually, this patient comes to me long back with migraine and he was cured. Another thing, please come in mind. Whenever the patient comes to you with one complaint, don't consider only that part. Holistic concept. You see, homeopathy is based on two things. One is individualistic, another is holistic. We have to take the case from head to foot. The patient can say, doctor, this is my troublesome symptoms. Please give relief to this. I don't want to say others. You must convince the patient that what is the basis of homeopathic practice. Until and unless you convince the student, you convince the patient, they will not disclose. Another most important thing you must consider that whenever you take the case, patient may not say many things. First step, you allow the patient to speak. Don't say, as Dr. Tiwari said at the morning session, listen, listen, listen. Whenever this stops, as you know, in case taking, you have to write down each symptom for a one single line, give a gap in between, so that you can fill it up afterwards, because the patient do not know the importance of your location, sensation, modalities, and concomitants. Initial stage, they will not say. So first of all, you allow the patient to speak, listen. Write down one line for each of the symptom, give a gap in between, okay? Everything complete. What else, what else, what else? At time will come, he will not say anything. Then you go for interrogation. So you collect your information, whatever you need, and fill it up. And during that, what I did, you teach your patient on some homeopathic philosophy. Philosophy does not mean vital force others. That means you say that in homeopathy, we teach the patient as a whole. So we have to say everything from head to foot, because he do not know the importance of each and what is sleep, urine, stool, dream, sleep, mind, they do not know. But you have to, what I did also, I have a pamphlet in my clinic, homeopathy, why and when. Very simple language, so that the patient can also learn something out of homeopathy. Because many patient comes to us, doctor, I will take your medicine, whether it will all aggravate my complaint. Suppose a patient comes to you with menorrhagia, leading to anemia. So if you increase the more bleeding, it may increase more anemia. So patient will be afraid of homeopathic aggravation. In this regard, I also want to differentiate the three aggravation, because that will go on. During your clinical practice, you may get three types of aggravation. homeopathic aggravation, disease aggravation, and medicinal aggravation. Homeopathic aggravation, I have already told you, but at the same time, I want to add that appearance of certain discharge after homeopathic medication is also a type of homeopathic aggravation. Number 2, the patient feeling of well-being. Although there may be aggravation of existing symptoms, but the patient feels better. The patient's sleep will be improved, his oil will be improved, his appetite will be improved. In spite of that, there is aggravation, and that is homeopathic aggravation. But at the same time, what symptoms will be aggravated? Suppose you have given lycopodium on the basis of the 3 symptoms, 4 symptoms, or 5 symptoms. Those symptoms which are similar, on the basis of which you have prescribed, that symptoms will be only aggravated. You understand my point? That slight intensification of the symptoms to which you give the medicine because they are similar. As I told you, in the secondary curative action, it will produce a similar, stronger disease. Similar to what? Similar to the symptoms which you have mixed or matched. That will be increased. But at the same time, the patient feels better, and if you give placebo, that will gradually decrease. But what about disease aggravation? Disease aggravation, the disease will proceed according to its own course. As for example, you are treating a case of fever, and the patient comes to you in the first week. You are giving homeopathic medicine, but you see, of the second week, there is no remission of the fever, and the symptoms of second week of fever, as you studied in our practice of medicine, develops. That means your prescription was wrong. Disease is going according to its own disease process. This is disease aggravation. You have to select a correct homeopathic medicine. Now, what about medicinal aggravation? In case of medicinal aggravation, you will get, if you go on giving large doses of the homeopathic medicine, or in the very sensitive cases, they may produce different types of symptoms of the medicine which you have applied. And that knowledge you will get from the knowledge of your materia medica. So whenever a patient comes to you with aggravation after homeopathic medication, you need to differentiate the 3. Is it a homeopathic aggravation? Then what to do? Is it a disease aggravation? Then what to do? Is it a medicinal aggravation? Then what to do? Because your course of action depends upon that evaluation. So our assessment, not to use the evaluation, assessment. Now coming to this family history, mother bronchial asthma. Physical generalities, you see, the patient was obese, thirst 2 to 3 liters per day, sleep good, no specific dreams, sweat profuse, not offensive, desire nothing particular, aversion nothing particular, hot patient, history of recurrent cough and cold. What's the miasmatic analysis? Moles, excessive abnormal proliferation, that is psychotic, history of recurrent cough and cold, aggravation rheumatism, psychotic, loose cough after exposure to rain with profuse watery expectoration, psychotic, often suffers from heartburn, aggravation fruits, psoric, stool constipated hard, psoric, obese, psychotic, family history, mother bronchial asthma, that is psychotic. What is miasmatic diagnosis? A mixed miasmatic case with psychotic dominance. Please keep in mind, again we'll come. A chronic disease may have only one miasm behind. It may be only psora, it may be psychosis or syphilis, or it may be a combination of 2 or 3. It may be psoriasis, psoriasis, or the combination of psoriasis and psychosis. If single miasm is involved, it is not so difficult. But how to manage a mixed miasmatic case? Psoriasis, psoriasis, or all the three miasms. Please keep in mind. At one time, one miasm will be most predominant. And usually, the psora is most troublesome, and you have to prescribe on the basis of the only psoric symptoms. Please keep in mind, you have to segregate what are the symptoms of psora, and on the basis of which you need to prescribe anti-psoric medicine. Please keep in mind that that does not mean only one medicine may cure. It may or may not. But you need to progress or change the medicine according to the changing symptom totality time to time. It may be 2 or 3 medicine, but not 2 or 3 medicine at the same time. At different times, you need to prescribe different medicine depending upon the changing totality. So that is very, very important. So psoric symptoms will be removed. Then what happened? Among the remaining 2, one miasm symptoms will be predominant. Then you have to give medicine on the basis of that miasm. That miasm will be removed. The last one, whatever remaining, you have to give that one. And as we say, that psora is the beginning of all sickness. At last, you may need to give anti-psoric treatment. So this is the basic management of mixed miasmatic cases. Now here is a mixed miasmatic case with psychotic dominance. What I prescribed, Dalkamara 30. Why Dalkamara? Please, you must, whenever you go to the anything, you try to understand that what is the basis, why he prescribed. Please keep in mind. Whenever you go to or attend your OPD or IPD, even during my student's life, don't think that, yes, doctor said, give me, in a case of fever, Dalkamara. So anything, any fever comes to you, we'll give Dalkamara. No. You have to learn that why he prescribed Dalkamara. What is the basis of prescription? Because no 2 patients are alike. So what is our learning? Learning should be to know the basis of prescription. Here I given the Dalkamara 30. Why? Loose cough after exposure to rain with profuse watery expectoration. Please keep in mind, a patient having chronic disease comes to you with some acute problem. Here the patient usually comes to me with that. But at the same time, he told me that I am suffering from loose cough for the few days after exposure to rain. That's why I addressed initially with Dalkamara to give relief to this particular acute complaint. That's why loose cough after exposure to rain with profuse watery expectoration. In this connection, I must mention that according to Hahnemann, you try to understand the probable cause. But at the same time, you need to have the symptoms of that particular drug. You see, exposure to rain may have Rustux, may have Dalkamara, may have natrum sulf, or other drugs. So to prescribe a drug, you need to have not only the cause, but also the manifestations. Manifestations of Dalkamara, manifestations of Rustux, manifestation of natrum sulf, they are different. So you have to only exposure to rain, give Rustux or Dalkamara. That will not serve the purpose. In this connection, I must mention, please keep in mind 8 symptoms, 8 parts. Location, sensation, modalities, and concomitants. Next, mode of onset. That is very important. After exposure to rain, how many days after he develops, whether it is sudden or gradual? Think of gelsemium. think of bryonia. They are gradually in progress. So, probable cause, mode of onset, treatment taken, and its after effects. I'm not talking about others. Treatment, what treatment he has taken. Many a times, in your common practice, you will say, doctor, I suffered from cough and cold for the last 2 or 3 days after exposure to cold. There is fever. I take paracetamol. And after no cure, then comes to us. Now, what is how to prescribe on that case? Please keep in mind, according to Hahnemann, you have to prescribe on the basis of the uncontaminated natural disease symptoms. So, as it is an acute disease, you will get all the information. Doctor, after exposure to cold, there is severe watering from nose, loose cough, much expectoration. But after giving your paracetamol, all disappear. Now I am suffering from dry cough, this and that. But you have to prescribe on the basis of that earlier symptoms. In this, that is very, very important. If the time permits, I can also, because in your daily practice you will come. Continue. How much time you can give? 2 minutes, okay. So 2 minutes I will finish. I can finish within 1 minute. Anyhow, basis of prescription. Cough much reduced after Dulcamara, moles no significant change, then prescribe Dulcamara 200. No cough, moles no significant change, prescribe Dulcamara 1m, Thuja mother locally to continue. Pain and itching and discharge much reduced, prescribe placebo. You see the changes in the moles, changes. Moles disappeared, scarring on process, no discharge, prescription placebo. Mole disappeared, prescription placebo. Moles disappeared, but discoloration of the skin still remains. Then I switch over to Thuja. Thuja is complementary to Dulcamara, number 1. Number 2, you think of all the miasmatic symptoms. That also covers Thuja. So I prescribe Thuja. Moles disappeared, but discoloration of the skin still remains. This is placebo. You see the result. You see, there is no moles, no desire. So, time is so many cases. I will show you one case. This is a case of allergic rhinitis. It's not so difficult. I will only show you miasmatic analysis, P auricular mass. A case of varicose ulcer. I will see only the last one. That what you see the first slide. The appearance of the varicose ulcer. You will get many cases. Prescribe arnica. Basis of prescription, soreness and bluish discoloration of the right knee developed after injury. Next, severe burn, black. You see the black and crusty oozing. Prescription, placebo, placebo. I prescribe anthracinum. Anthracinum 200 followed by 1m. You see that how the particular ulcer is being reduced. Followed by syphilinum. 1m. You see the ultimate result. You see, this is homeopathy. You see, arnica, anthracinum 1m, ultimately leads to syphilinum and complete cure. You see the gradual transformation from the ulcer to this one. So, I want to conclude. There is a case of brain tumor. The time is, I am not, lot of cases are there, brain tumor cases. There is other cases of velour treatment. Just at the last stage. Just you study the chapter 1 of the philosophy book of Dr. Roberts. Chapter 1, what has homeopathy to offer to the young man? The last 3 lines. Homeopathy as a profession carried a challenge. The possibilities of its art are infinite. What future has homeopathy to offer to you? Young man, what have you to offer homeopathy? What you can offer to homeopathy? We are thinking like that. And the last one, just if you want to understand Hahnemann's philosophy on chronic diseases, you can go through my books. This is all you know, but better to understand homeopathic only for your theoretical understanding, but you put in your practice. I am going to develop this hospital. Within 6 months, I am going to inaugurate that. And I will want to show you clinical teaching, how we can clinically teach the students, they'll learn. This is my dream of my life, that I will survive only 5 or 10 years, but so that survival of homeopathy, following homeopathic classical approach will be there, I will try to introduce in my hospital. But one thing, last day, when we were visiting 150, this is Mahatma Gandhi, I will show you.
Day before yesterday, we visited Mahatma Gandhi Museum, where Mahatma Gandhi studied. Alfred High School, જોઈ છે? અંદર visit કરવા જેવી છે. It has been inaugurated by Honorable Prime Minister and Gandhiji આખી life. And one quote, sir, want to read that quote.
You continue, I will read.
So, what I was observing, મને નથી ખ્યાલ, પણ though despite organ and આપણને એમ થાય કે એમાં ક્યાં cases આવે. But if you've seen the first case, and when sir was explaining each and every concept of organ and primary action, secondary action, analysis, evaluation, some students were asking me in the lunch break, कि सर हमने मेडिसिन तो बता दिया लेकिन कैसे उसको ढूंढना है उसको माने एनालिसिस इवेल्युएशन કેમ કરવાનું એમ કોઈ સિમ્પટમ્સ આવે તો કેવી રીતના કેસ જોવાના there were enough cases and enough queries कि how to select the symptom or what symptoms needs to be selected for the basis of prescription કેસ લઈએ ત્યારે તો ઢગલા બંધ આવે છે so how to discipline that case taking is an art but how art can be mastered art and science એમાં કેસ ઉપર કે પેશન્ટ ઉપર કામ નથી કરવાનું honestly speaking what homeopathy has taught me in person કલ્પિત સંઘવી જો આજે કલ્પિત સંઘવી હોય ને તો it's because of homeopathy homeopathy કાઢી નાખો ને homeopathy if you remove homeopath from me I become zero because homeopathy has given me such a vast understanding of life and living. You need to go inward to understand. You need to silence your inner voice. Because so many times we have a lot of inner voices. આપણા મગજમાં ચાલતું જ હોય. And we are constantly evaluating and listening people's voice through our spectacles. ચશ્મા હોય આપણી પાસે. આ માણસ આવું કહે છે ને લાવવું હશે. આ માણસ આવું કહે છે ને લાવવું હશે. We hear from the voice or the filters of ego, insecurities, comparisons, our past experiences, and we analyze so many things and we don't just put ourselves aside and try to listen. That's what, again, I remember that statement. કે just listen, be silent, have a silent, being silent means internally silent. આપણે બોલતા નથી એનો અર્થ એ નથી કે આપણે અંદર પણ નથી બોલતા. We are talking inside, right? આપણને થાય છે ને અત્યારે કહે છે આપણા કેસીસ જોયા મટીરિયલ એના ઓર્ગેન અને રેપર્ટરી ત્રણની સમરી બ્યુટિફુલી ધીસ ટ્રિપલ ટોક આઈ મસ્ટ થેન્ક્સ વેરી મચ પ્રવીણ સર, તિવારી સર એન્ડ દાસ સર for beautifully weaving the whole picture of three fundamental subjects which is very much essential for any homeopathy practitioners to practice. તો બીજી વસ્તુ શું જોવા મળી? The results of homeopathy which you have seen, powerful results, very easy methods also, એવું જરૂરી નથી complicated છે. There are cases which requires deeper understanding, there are cases which requires thorough analysis, there are cases which unlocks with a small 1 or 2 symptoms and you can prescribe that. Praveen sir has shown some of the keynote prescribings and pathological prescriptions and results are the same. It is not that if you prescribe on pathological journals or a keynote prescription you don't get results, not like that. So many times being, and what I say, aphorism 6 actually a sadhana છે. Being unprejudiced is literally next to impossible for a living human being and it's a constant effort of any homeopath. મારા વિચારો, મારું લર્નિંગને સાઈડમાં રાખીને I need to see. That's why Hahnemann could able to see this. Otherwise he would not have seen this. How can this beautiful system can be evolved out of a single experience of Cinconabark? One, he says it's a reinvention, it is not his invention and he is meticulously observing, improving himself day in and day out. His repertory work, sir said, Bonnie Gusen was the first to create the things, but before that he has handed over the task to Dr. Zar and he was not satisfied with the things. So constantly dissatisfying with the self to get the perfection and 1% a day, 1% a day and you tend to get a lot of new insights. હવે જો રસ, sir has beautifully said you should love homeopathy. There is a book called The Romance of Homeopathy. Do you know that? કોણે લખી છે? Dr. Margaret L. Tyler has written a book, a very small book, The Romance of Homeopathy. And if you love someone, that means you definitely understand that person. So if you love the subject, if you love the science, you understand the subject. એમાં કંઈક મળશે ભાઈ, બીજે ક્યાંય પડોમાં, મને ખબર પડે છે. ફોકસ છે ને હજી અહીં ક્યાંક પાછળ આવશે, બાકી કાંઈ નહીં આવે ભેગું. અને ફોર ધીસ જનરેશન the average attention span of this generation has reduced to so much so fast. તમારું attention span છે ને, I am really happy કે આખો દિવસ જે લોકો બેઠા સાંભળ્યું ને, this is an exercise of you to learn with a focus for a longer period of time and it is a challenge. Average internet surfer ની life કેટલી ખબર છે? 6 સેકન્ડ. Average internet surfer's life is 6 સેકન્ડ. એટલે ટ્વિટર ચાલે. રીલે આપણી બહુ નાની હોય છે, લાંબી સ્ટોરી ન જોતા હોય, લાંબી ફાટ વિડીયો. વી આર મૂવિંગ સો ફાસ્ટ ઇન ધી એજ ઓફ ટેકનોલોજી એન એરા. આપણી પાસે ટાઈમ જ નથી ટુ હેવ અ પેશન્સ એન્ડ ટુ સી એન્ડ લુક એવર ધ થિંગ્સ. તો પેશન્ટને ક્યાંથી જોવાના ભાઈ? then you need to silence અને patience અને focus. That gives an ultimate success. Yeah. Das sir.
This is the word of Mahatma Gandhi ji. We can apply in homeopathy. To my mind, there is one thing needful for every one of us. That is, we should think over what we have read, digest it, and make it integral part of daily life. That means what your teacher teach, think over it, then digest it, then put in your own practice, so that you will be a successful homeopathic physician, and, and you will be useful to the society without thinking job. Please, you can apply the word of Mahatma Gandhiji, read it, digest it, and put it in the daily practice. Thank you all.
Thank you, sir. Thank you. Get ready for the quiz. Ready? Great. Arwa madam, give the link. ક્લાસમાં મોબાઈલ લેવાની મનાઈ છે, અહીંયા કાઢવાનો છે. Bring out your mobile phones.
All be ready with your mobile phones. All can open pan quiz
you can
in Google,
scan this quiz.
or you can scan the QR code and enter the PIN number. All please see that you are logged in. In between the quiz, if you log out, you will not be able to re-log in.
So
The
your
rules-
login has to be constant. Either scan it or you can log in through play.panquiz.com and enter
Everyone,
the PIN.
please,
Yes.
write
See,
your
these are
complete
joining.
name.
These are people are joining. Beautiful.
The rules for the quiz is, everybody please enter your complete and full name, no nicknames or short names.
Enter your full names.
The question will only be visible on the screen with the options. In the mobile phone, you will not be able to read the question or options. So please be attentive on the screen. And the color code which will be there of the options will be available on your phones. You have to select as per the answer on the color code.
आगे सब आ रहे.
Still 235 only have joined. Blue pattama.
327 players, 32, 333, 335, 78. Here are the players who is joining over there. હજી 50% જ પહોંચ્યા છે.
Yes. This quiz is not only the test of your knowledge but also your attentiveness in the seminar.
યસ. આખા દિવસમાં જેટલું તમે શીખ્યા છો ને એનું પણ ક્વેશ્ચન્સ હશે અને પ્રી રેટેડ ક્વેશ્ચન્સ હશે.
Online. The marking system and the results will be on fastest finger first basis. So not only your correct answer counts, but in the shortest possible time also matters. So we are ready to begin the quiz.
Ready to begin the quiz? બહાર નીકળી જાશો વચ્ચેથી તો પાછા એન્ટર નહીં થઈ શકો એટલે pay attention to it. Go ahead.
Can we get the question number 1, please?
Pen quiz.
Sir. You have to answer from your phone. Please see the color code and the shape. Next question.
149. આમાં વાર
Ready for the next? To which category does the Catherine Coulter book, Catherine Coulter's Drug Personalities, belong? Sir, તમારે કંઈ કેવું છે ને અત્યારે જ?
ચાલુ મેં પોઝ રખાયું છે મને થયું પ્રાઇઝ મને ડિક્લેર કરી દઉં. ફર્સ્ટ પ્રાઇઝ 2000 rupees, second 1001, third is 500 rupees. First maximum and a first, right?
Ready to continue. Next question. In Dr. Aruna's case of Mullerian agenesis, which myism was dominant?
Today's case, Dr. Praveen Kumar presented. Oh, wonderful.
Next question, please. What is SMA syndrome? Please fill your personal answers.
First answer કરી દો પછી ટાઈમમાં બીજા પેલા કરી દેશે. Maximally attending, sir. Your case has been well acquainted by the students. This is the score.
According to Hahnemann, which of the following is considered the root cause of myisms? question. When should a clinical repertory be used? What are pathological general symptoms in homeopathy? Which of the following best describe Boger's method of repertorization? So the 10th question. Medicine is learned by the bedside and not in the classroom. Who said this? Now we see the scoreboard. There are 5 more questions left, so be ready. Homeopathic treatment is based on to treat a chronic disease, a physician needs to base a prescription on basis of which of the following? Last 3 questions. Which repertory is known for giving importance to time modalities? Not accepting responses, got it.
Show your mobile phones. Wow, wonderful. Wow. 13. Next 2 questions remaining. 2 more.
What What is an example of unmodified materia medica?
મોબાઈલ હેક થઈ જાય. આવે. ચાલો, go ahead, go ahead.
Okay. I got the message that there's some connection error. So we will consider till the question number 13. But this is for your knowledge, so we can all join in this. Who coined the term keynote symptom? Hope all of you have enjoyed. The third place is secured by Gadhar Rinki, second place by Prajapati Preeti, and first goes to Dr. Payal Jamod. I request our distinguished speakers to please join us on stage. I request all these three winners to please come on the stage.
Dr. Payal Jamod, Dr. Prajapati Preeti and Gadhar Rikin.
I request Gadhar Rinki to please come on stage.
Third prize.
I request Praveen Kumar sir
Praveen Kumar sir.
to please give the
Get third prize to
gift to Gadhar Rinki.
one by one. पहले गा आइए तब पहले आइए इसको आइए जा थर्ड प्राइज Gadhar Rikin. Which college? Aryaved. Second prize, Preeti Prajapati.
Dr. Preeti Prajapati from HN Shukla College.
Thank you, thank you.
And the first prize, Payal Jamod. Which college?
She's from BG Garaya College.
From BG Garaya Homeopathic Medical College. Wow, wonderful. All the three participant colleges winning 1, 2, 3 prizes. Thank you. Congratulations. Three different colleges. God bless you.
अब इस क्विज कंपटीशन के बाद नेक्स्ट कंपटीशन पोस्टर प्रेजेंटेशन कंपटीशन के विनर्स का अनाउंसमेंट का टाइम है. गुड आफ्टरनून एवरीवन, माई सेल्फ डॉक्टर पूर्णिमा शर्मा एंड पोस्टर कंपटीशन पोस्टर प्रेजेंटेशन कंपटीशन में हमारे पीजी स्कॉलर्स और रिस्पेक्टेड फैकल्टीज़ ने पार्टिसिपेट किया और अपने रिसर्च वर्क को बहुत इफ़ेक्टिवली प्रेजेंट किया है. और नाउ इट्स टाइम टू अनाउंस देयर नेम्स. सो फॉर द थर्ड रैंक आई एम गोइंग टू अनाउंस फॉर द थर्ड रैंक, और यहाँ पे हमारे पास में 2 पार्टिसिपेंट्स हैं. सो फर्स्टली मैं बुलाना चाहूँगी हमारे पहले पार्टिसिपेंट को, जो कि है डॉक्टर वृक्षा मेहता. एंड इसके लिए मैं स्टेज पे डॉक्टर अरवा मैम को इनवाइट करना चाहूँगी कि वो यहाँ आके उन्हें सर्टिफिकेट प्रोवाइड करें. यस, सो थर्ड रैंक पे हमारे जो दूसरे पार्टिसिपेंट हैं दैट इज़ डॉक्टर अंजलि गुप्ता मैम. एंड इनको सर्टिफिकेट प्रोवाइड कराने के लिए मैं स्टेज पे बुलाना चाहूँगी डॉक्टर ख्याति मैम को. प्लीज़ कम. हमारे दोनों ही पार्टिसिपेंट्स को बहुत बहुत कॉन्ग्रेचुलेशंस. एंड नाउ इट्स टाइम फॉर सेकंड रैंक विनर, एंड इट इज़ डॉक्टर पूर्वी अन्नानी मैम. एंड इसके लिए मैं स्टेज पे बुलाना चाहूँगी डॉक्टर विभूति मैम को. प्लीज़ कम. Very, very congratulations, ma'am. And now it's time for our first rank winner, and this is Dr. Priyanka Niset. And for this, मैं Dr. प्रशांत सर को स्टेज पे बुलाना चाहूँगी.
Anybody from RHMC College? Rajkot Homoeopathy College? Because Dr. Priyanka has left, so please collect on behalf of. Avi jao, madam. Samar sir.
Moving further in the event, now we have an interactive panel discussion session. The stage is yours. Everybody is invited to ask questions to our esteemed speakers.
We have received so many questions before end the seminar. This time we have those who have registered earlier. We sent them to. We requested them to send the questions, so we can always ask. So many questions were answered by the speakers in the sessions only. But despite of that, હું આ questions પૂછું છું. એ સિવાય પણ કોઈને પૂછવા હોય એકાદ 2-4 questions audience માંથી પણ સાથે લેશું. I'm raising the questions on behalf of the students and the practitioners we received before and for the speakers, right? So the first question, that's a big question rather. I'd say all of three you need to answer because it carries out the component of all the three. What is case-taking instruction given in the organ of medicine? And how can rubrics be identified from it? So case-taking questions, I think, Das. Mike.
Again, repeat.
What are the case-taking instruction from organ?
कहाँ पे दिया?
हाँ, organ में case-taking के instructions. What is the case-taking instruction given in the organ of medicine? How can rubric be identified from it? That you need to answer that. Second one.
83 to 105 aphorism. If you go through, you will get it. That instruction.
Case-taking is a part of 83 onwards?
105.
105. Already it's a part of second year curriculum, right? We have not studied that. And from second year onwards, these are questions. But practically considering my question એટલા માટે લઉં છું કે ઓર્ગેનની અંદર rubrics fund કરવા નથી. Sir Sir said, one sir mentioned that keynote is not mentioned in the organon, right? Keynote word has been coined by?
No, one thing you see, case taking, after case taking, you have to analyze the symptoms, okay? Then on analysis, what you are talking, that which symptoms will take, which symptoms will not take. That is important. You exclude the common symptoms. If you think of 153 aphorism, it is very, very clear cut that you should exclude the common symptoms of the disease, and homeopathic prescription is based on characteristic symptoms. What are those characteristic symptoms? The uncommon, peculiar, striking symptoms are uncommon, peculiar symptoms. Okay, so after case taking, you need to evaluate the symptoms. All symptoms are not of equal value. There are some symptoms which are common to the disease. To exclude all those symptoms, then you consider the symptoms which are uncommon, which reflect the individual person, okay? On the basis of which you can prescribe. As regards repertorial method, conversion of symptoms into rubrics. What is rubrics? Rubrics are the repertorial language of the symptoms of our materia medica. So whatever you are taking, you have to convert into rubrics, and that rubrics you have to search out in your repertory to find out what are the symptoms, what are the medicines to be considered under that rubrics. So rubric searching is a process by which you can search out that which chapter that particular rubrics will get. So you need to know the construction of that particular repertory which you are using. So
Sure.
conversion of rubrics.
Tiwari sir, after taking a case, after analyzing a case, do you have specific, what is the commonest repertory you use in your practice?
See, as I was telling also earlier, it is the case which decides the selection of repertory. अगर आपने एक केस लिया, उसमें आप देख रहे हैं कि there are a lot of emotional symptoms. एक पेशेंट आया है, उसको हेडेक है, उसको हिस्ट्री ऑफ ग्रीफ है, उसके घर में कोई मर गया है और उसके बाद से ही हेडेक चालू हुआ है. तो इस तरह के केस में यूजुअली देयर आर लॉट ऑफ इमोशनल सिम्टम्स. तो आप देखेंगे कि कौन सा रेपर्टरी है विच इज़ इनरिच्ड विद द मेंटल सिम्टम्स. तो यहाँ पे कॉज क्या है? ग्रीफ है. तो सी एलिमेंट्स फ्रॉम ग्रीफ यू फाइंड इन द कैंट. सो इफ a case is dominated by इमोशनल सिम्टम्स, मेंटल सिम्टम्स, तो केंट के हम लेते हैं. इफ़ ए केस इज डोमिनेटेड बाय जस्ट कंप्लीट सिम्टम, हेडेक ही है लेकिन हमको कुछ मिला नहीं, लोकेशन मिल गया है, किस तरह का पेन है, और हेडेक के साथ में स्टमक का सिम्टम आ रहा है, तो वी हैव गॉट एग्रेवेशन, वी हैव गॉट एम्यूलेशन, वी हैव गॉट कॉन्कोमिटेंट एंड लोकेशन. तो उस तरह के केस में हम बोनिंग हर्शन मेथड थेरेपेटिक पॉकेट बुक के ले जाते हैं. और एक केस ऐसा आ गया कि टेंडेंसीज ऑफ पैथोलॉजी इज देयर, क्योंकि देखो पैथोलॉजिकल एक जनरल क्वेश्चन भी था. पैथोलॉजिकल जनरल इज नॉट जस्ट पैथोलॉजिकल सिम्टम, it's a tendency to develop that kind of pathology, like tendencies, hemorrhagic tendencies. ये pathological general है. तो इस तरह का अगर tendencies मिल गया, discharge की peculiarities मिल गई, tendencies for the growth, tendencies for necrosis, for inflammatory, तो उस तरह के tendencies अगर pathological general मिल गया, जैसे कि बोगर बोलते हैं, you got a thread, तो उसमें BBCR हम लेते हैं. So it is the case which decides the selection of repertory and not the physician. Case demand कर रहा है कि भाई इतने symptoms है, केंट में जाओ, केंट में जाओ, तो जाओ केंट में. केस बोल रहा है नहीं हमारा इतना ही symptom है, हम लोकेशन सेंसेशन में ही है और कुछ मिल नहीं रहा, तो बोनिंग हर्शन में जाओ. So remember this idea, and this question is a wrong question. Which repertory is important? Every repertory is important. The case decides the selection of repertory, not the physician. अब हम तो यूज करते हैं जिस तरह का केस आता है उस तरह का करते हैं.
Means you are keeping all the repertories into your desk.
Yes, I have got in my cupboard all the repertories, and most of the time I don't, because I have repertorized lot of cases. Kent ने भी कहा है कि if you have repertorized 100 cases properly, you may not further require repertory. But I refer each case.
Each case with the repertory.
फंस जाता है कहीं तो हम देख लेते हैं भाई इसमें इस रूब्रिक में वो सिम्टम है कि नहीं, वो मेडिसिन है कि नहीं, ऐसा करके हम रेफर करके, एंड व्हेन आई एम कॉन्फिडेंट दैट दिस ऑल रूब्रिक्स आर कवर्ड बाय वन रेमेडी, देन आई गो. कभी कभी 2-3 रेपर्टरी भी आपको रेफर करना पड़ता है. यू कैनॉट बी जस्ट लिमिटेड टू वन रेपर्टरी. कभी कभी रेपर्टरी के बाद मैट्रिया मेडिका भी रेफर करना पड़ता है, लेकिन जिस तरह का आपका एक्सपीरियंस होगा इसका यूज़ कम होता जाएगा. जैसे शुरू में आप मटेरिया मेडिका में ही रेफर करो, लेकिन बाद में क्या होता है कि जब आपको अच्छी अच्छी मेडिसिन याद हैं, यू कैन ईजिली डिफ्रेंशिएट, यू नीड नॉट रेफर मच. तो इट डिपेंड्स ऑन योर एक्सपीरियंस, नॉलेज ऑफ मटेरिया मेडिका, नॉलेज ऑफ रेपर्टरी. तो ये सब आपको जब है तो आप केस लेते हैं तो मालूम होता है कि किसको रेफर करना है, किसको हमको मालूम है. So remember that case decides the repertory, and also don't forget to refer and confirm your medicine always. क्योंकि एक बार prescription wrong हो गया ना तो केस को बिगड़ते देर नहीं लगती है.
Yeah. So many times we have lost number of cases with mismanagement of homeopathic management cases. Yeah, that's true. So we'll go a little fast because we want to take up more questions. Right? My questions to Praveen Kumar sir. How to handle cases with systemic diseases like hypertension and diabetes?
Yes. Till now, these diseases are termed as lifestyle disorders. And as such, there are no evidences of complete cure in any system of medicine. There may be few exceptions. Such type of diseases, we cannot claim that we can cure the patient, but we can definitely treat the patient and see that his parameters, his symptoms would become normal. And it is always preferable to keep the patient on our medicines rather than other systems medicines for a longer period, because it needs to be treated for a longer period, because there is no sight of cure in the recent time.
उसमें ही extension है. How to approach chronic cases where mental generals are lacking, or we are not able to find out the right mental pictures and chronic cases are there.
Chronic cases?
How to approach a chronic cases where mental generals are missing or lacking or unable to find out.
No, it can happen. In all the cases, we cannot have a mental symptom. As somebody was asking, most of the times, like he is an engineer, he was telling, Most of the times you homeopaths ask for mental symptoms and you become mental. So it is not like. There would be, but we can observe the patient, we can see the behavior, we can see the state of the individual and extract the information from that. Even if they are not available in a chronic disease, as we approach any patient, we can erect the totality in that case also. There could be a past history indication or a family history indication, personal history indication, or his own symptomatology, his own indications. So always we may not depend upon, like Dr. Tiwari already said, like in all the cases we may not get mental symptoms so as to go to Kent repertory. We'll get so many cases where we may not get mental symptoms at all. So we need to treat them also, even without mental symptoms.
Before I proceed, I instructed ki anybody want to ask the questions, please write down and send it to the volunteer so I can ask on behalf of you. You can write down the question and send it over here. So I will take live questions first. Sir, Tiwari sir, comparative study of different repertories. Right now there are many repertories. पहले तो हम लोग पढ़ते थे कार्ड repertory से लेके Kent, Boger, Bonigusen, different approach, NER repertory, complete symptoms का. Right now, nowadays, computer repertories are available easily. So, is it good to go for computerization of the softwares or you should go for the books?
See, to learn, you have to go to the books. When you have learned, you can practice with computer because computer is fast. Earlier, there was the excuse that if you go for repertorization with big books, it takes time. That was true. And that is why repertory were untouchable. People used to avoid repertory because कौन जाएगा वो इधर symptom लिखो, page number लिखो, marks लिखो, calculate करो, उसके लिए problem था. But to learn homeopathy repertory, you have to learn books of each repertory. और जब master हो गए आप, सिम्टम मालूम हो गया, रूब्रिक मालूम हो गया, तो उसको प्लेस कर दो कंप्यूटर में, एक क्लिक कर दो, मेडिसिन आ जाती है. तो कंप्यूटर इज वेरी इंपॉर्टेंट, बट टू लर्न होम्योपैथी रेपर्टरी यू हैव टू गो टू द बुक्स.
डू यू मीन दैट कि इट इज नॉट ओनली द हंटिंग द रेमेडीज, it is actually a principle, fundamental concepts behind the repertorization.
To say in other words, repertory is not just mechanical tool. It's a device based on a logic, on principles, which should be applied while dealing with the repertory. Otherwise, if it is a mechanical process, it will give you a mechanical result and it will not be successful. तो केवल रूब्रिक खोज के, अभी क्या है कि लोग करते हैं कि भाई पेशेंट आता है, ईच सिम्टम दे गो ऑन रिकॉर्डिंग कंप्यूटर में, अब फाइनली बोलते हैं ये तो मेडिसिन का ग्रुप आ रहा है. नहीं, each symptom in that case is not important. Take only important symptoms, like he was telling, totality after the evaluation and analysis. तो जो important symptom है पहले उसको समझो, फिर उसको रेफर करो. So repertorization, please don't make it a mechanical process. Otherwise कि एक कंप्यूटर एक्स इंजीनियर करेगा सब कुछ, वो नहीं हो सकता है. एक होम्योपैथ को थोड़ा सा नॉलेज हो कंप्यूटर का तो बहुत अच्छा रिप्रेजेंटेशन कर सकता है, लेकिन एक कंप्यूटर इंजीनियर कभी नहीं कर सकता, वो मैकेनिकल प्रोसेस हो जाएगा.
Because he don't know the logic behind selecting the symptoms.
Correct.
And computer mechanically categorize the symptoms.
He cannot correct.
I would like to add to this one greatest advantage of repertory, which you can definitely use in your clinical practice. When the patient is narrating some symptoms, like for example, a patient told about the cough, and if you just immediately refer to the repertory, rubrics, sub-rubrics, it would give you a hint. What questions should you ask when once the patient completes his narration? You will know a lot of things. There are so many expressions of each symptom which you may not be aware. You can ask those questions also. Keep in your mind, I'm just giving cough. You can see even mental symptoms. You can see any other chapter. Repertory gives a lot of scope of questioning.
It helps in case taking also, the computer. Also the type of cough in some of the repertory software, if you just click the type of cough, it shows how the cough is heard. So it's just addition of learning. It is like barking cough. The computer will tell you what is barking cough. But it's all additional knowledge. But to learn repertory, please go through each repertory books, go to the chapter, rubrics, arrangement, philosophy followed in arrangement, and working method. Each repertory when you master, then you go to computer.
Each repertory has a different conceptual framework also.
Yes.
Like Murphy also has a special
नहीं,
chapter on
देखो, ये जो-
emergency,
नहीं,
while no other repertory is having it.
हम बता रहे हैं 3 बेसिक रेपर्टरीज है, केंट, बोनिंगशन और बोगर. बाकी जो ये रेपर्टरीज आई हैं ना, दे आर बेस्ड ऑन दीज रेपर्टरीज एंड दे आर इम्प्रूवमेंट ओवर दीज रेपर्टरीज. अब मर्फी है, ये सिंथेसिस है, दिस आर ऑल इम्प्रूवमेंट ओवर द केंट्स रेपर्टरी एंड दे हैव कंबाइंड अदर रेपर्टरीज. तो पहले 3 बेसिक चीज़ समझ लो, फिर उसके बाद इम्प्रूवमेंट में जाओ. अब डायरेक्टली आप जाओगे सिंथेसिस, तो यू कैन गेट लॉट ऑफ मेडिसिन विच आर नॉट नोन, नॉट प्रूव्ड वेल. 5000 मेडिसिन दे दिया है उसने, और केंट में उतना जेन्युइन मेडिसिन है जो कि आपके प्रैक्टिस के लिए काफ़ी हैं. आई एम नॉट टेलिंग दैट न्यू मेडिसिन शुड नॉट टेक अप, बट टेक ओनली दोज हु आर वेल प्रूव्ड. या अंदाज पे नहीं कि चॉकलेट खाता है तो चॉकलेट 30 दे दो, प्लास्टिक से हो या तो प्लास्टिक पोटेंटाइज करके 30 दो. उस तरह की मेडिसिन आजकल सिंथेसिस में आ गई है. सो फॉर जेन्युइन वर्क इन रेपर्टरी, first go through 3 basics repertory, Kent, Bonington and Bob.
So it is very essential to refer the books. I request those who are not participating actively into the interaction and panel discussion and want to discuss and chat can go outside and chat, because they are disturbing other students also. Dr. Das want to say something. चालू करिए, switch on करिए. ऊपर.
Just to supplement, if you see, each of the repertory construction and its use is based on certain philosophical background. That you first try to learn that philosophy. What is the philosophical background of the development of Kent and its construction? So if you master of that, you will be able to use Kent, Bogart, Boniason. So try to learn this. I also agree. We also do that. Try to learn that Kent, Bogart and Boniason.
Unless and until you learn the basic philosophy behind the repertory, to use that repertory, it is like without knowing the weapon, how to use it, and you are using the weapon, you will be bleeded.
Yes, yes.
आपको खुद को लग जाएगा, आप वो लगेगा. Now, 2 questions from Pran Kumar sir. Both are included. Amount of importance of pathology in homeopathy and should be given medicine on just pathological symptom, 1, and how to manage and treat a case of autism and ADHD child.
Yeah, pathology is definitely important because it gives you a guidance. Are we on a right track or a wrong track? It depends on each class of case and a particular case. If the pathology is advanced, you will not get any characteristic features and you will get only common symptoms, those particular symptoms. Then you have to depend on pathology and his common symptoms and prescribe. And whatever might be the statement or anything, whatever we talk, ultimately the patient wants relief in pathological perspective. If, for example, a patient comes with rodent ulcer on the face. One lady of 82 years was brought by her son-in-law with rodent ulcer on the cheek. And with this rodent ulcer of the cheek, so I have taken the whole case and we have selected pulsatile as the remedy. 0/1 was given. And in 1 month's period, the daughter, the son-in-law, both of them felt very happy. They said she is sleeping very well, she is eating very well, everything, everybody is very happy. But the patient says, my ulcer, there is no change in it. So it is equally important. I am not saying it is completely important. So pathology makes definitely an important prognostic criteria for us to treat, and we can base our prescription on pathology if there are no other characteristic features. Ultimately, it is the totality of symptom which we have to erect to select a right drug, and that totality depends on the different expression of each patient. If there is only pathology, for example, one-sided, physical in nature, where there is only like one vitiligo spot, I won't get any symptomatology. So the pathology becomes my guidance for the prescription. I need to see the pathology, prescribe basing on pathology, and give relief in terms of pathological relief. And the second question, autism and ADHD. That homeopathy has a greater role in the treatment of ADHD and autistic children. There are many cases in many homeopathic doctors' clinics. There are many doctors who are showing a lot of successful results. A lot of doctors in many seminars, conferences. Not only that, every clinic, whoever is little senior, even 10 plus years practice, they can definitely be successful in that. What we need to do is like autistic child, as Dr. Tiwari rightly said, like you need to see what are the common symptoms of autism and what are those individualistic symptoms of this child. If you can segregate, you can select a right remedy, follow it. And there were certain instances where the family history helped. As I was showing you the different types of prescription, the family history helped us to prescribe a right remedy in the treatment of autistic child. So they are very amenable to homeopathic treatment. We can definitely be successful in these cases.
Fast answers to all of three. 1 or 2 liners, please answer.
Yeah.
One of the cases where uterus can, is there any possibility of reverting all pathological cases? Mind it well, is it possible to treat all pathological cases? Number 1, yes or no?
No.
Das sir?
All pathological cases we can't.
No.
You see, there are some...
one line.
One line.
Yes
or no?
One line.
It's not
No.
possible to answer. There are some cases which you can...
So that means not all cases can be cured.
Not.
Right.
Yes, not possible.
So all 3 answers are no. One question to Dr. Das sir. You are going to build up an hospital. So is there any emergency ward going to present? And how to treat emergency cases? Are you treating
No, I
emergency
thought
cases?
somebody has asked, are there any vacancies? Can we join? That is also a question. There are so
That's
many
a
young
question.
doctors.
That has not yet
There are
came
so
out.
many young doctors. They are asking, are there any vacancies?
Yes. We have, you see, in our Calcutta Homeopathic Medical College, we have emergency and we deal emergency cases. Now, what do you mean by emergency case?
No, I said vacancy.
Vacancy.
Hospital vacancies. Job vacancies, they are asking.
No. They are asking about emergency only. This is sir's recommendation.
Oh, job
Okay, how
vacancy.
many of students you are going to hire them?
Yes. I have a job vacancy for treatment emergency cases by homeopaths, by homeopathic method.
Okay. Send your resume.
Yes.
Any specific approach which you told 3? Any specific approach do you apply into any emergency cases when it comes to a sudden rise?
Couldn't get you the question.
Any specific approach when any emergency case comes? Any specific? How do you approach to that case?
First, diagnose. You have to make the diagnosis.
Wonderful.
If you don't make the diagnosis, you are going to kill the patient because already it is emergency. Then your observation. In any emergency, it's an acute condition. Your observation is very important. Your observation will definitely select the right remedy. Don't ever think that you need to practice for 40 years to have the observation. You can have the observation from day 1 if you are attentive. As it was told, like what you don't have in your mind, you can't see it outside. So feed it to your mind, your brain, the knowledge. You can select a right remedy basing on your diagnosis.
One thing, please keep in mind. What do you mean by emergency cases? In my last Parveen, he has described one case with severe pain in the abdomen and treated by Colossians successfully. Is it not an emergency treated by homeopathy? So there is a scope, but at the same time, you need, suppose the patient having accident, severe hemorrhage, fracture, multiple complex fracture, patient is unconscious, you don't get the information, definitely you take the help of other science. That's why I always say that you need to know the scope and limitations. Homeopathy can cure a curable disease, can palliate an incurable disease, and such cases where there is no scope, as for example, you know that there in, suppose, certain cases like surgery, third precedentia, that is prolapse of uterus in the third stage, that is not possible to cure. So you have to know the scope and limitations. We have a scope in the emergency also, but as you rightly said, that you need to diagnose. A patient comes with arsenic poisoning, and you think that this is a case of cholera and you're treating. No. So you have to diagnose the case, then you have to see the condition of the patient, which can be treated by homeopathy. So that is very, very important. And if you go through the Hahnemann also, where there is sudden suppression of the functioning of the vital force, it is not within the domain of homeopathy initial stage. As for example, electrical shock, drowning, poisoning, in such cases it is not a dynamic disease. Please try to understand that what is a disease dynamically produced. If some disease is produced from outside cause where there is functioning of the vital force is disturbed, all on a sudden, it needs certain palliative treatment.
But that also, if no other modalities are available, can homeopathy prescribe that? That must not be your question, but to the authorities, especially in the area of, right now, emergency medicine can be used by a homeopathic practitioner or not.
That is a separate...
That is a separate case. Anyway, one of the questions to Praveen sir, somebody asked, how to select seal and potency in your case?
How to select potency in your case?
Scale and potency of the case.
Huh? Scale of potency.
How to select the scale and potency in your case? The money, sir, 50 millisimal low.
Sir, depending, simple principle, depending on susceptibility of the case, we can select the right potency.
Susceptibility,
right
nobody discussed today, na? So
Okay.
the last one, I'll take 2, 3 together. Somebody questions, case in some medicines, there were loath, so about many symptoms, but like that both are words, the use of their change, whole criteria of medicine. I have seen many people make mistakes just by translation in cases and materia. There are slenots in many descriptions in materia that we are not known of. How do we tackle that situation? Example, someone use word hate in case, some medicine, there is a word loath. So about how many symptoms, just like that, both are words, but the use of their change whole criteria of medicine. It is not the things, there are, see, it is, as being a mathematics teacher, I know, okay, what role of a mathematics teacher? Is it to translate the symptoms? If you have a query in the question.
Probably they are asking intensity of a symptom.
No,
Not
only that, because these are common questions for everybody. Almost. When we study, there are one word, say for example, depression, loathing of life.
Loathing of life.
There are similar kind of words and the medicine difference. Just like one case I described, rest aggravates, continuous motion ameliorates. Rust toxicity, and આપણે મેં વાત કરી Lilium tigni, activity ameliorates. What do you mean by activity ameliorates and motion, continuous motion ameliorates? Is there any difference between two? A huge difference. That's why it is said that you need to learn the dynamicity of a disease, what is suffering of a patient. Am I right, sir? Am I right? So when we pick up the word from the repertory or materia medica, we need to go back to the source books. Source books. where exact picture of proving comes in. Interpretation nowadays has been rampant. And I really warn people, especially the students, going into interpreting, analyzing too far, too stretched, before having fundamentals of understanding. So many times, kya hai? આપણી પાસે સામે બહુ ટિપિકલ પર્ટિક્યુલર સિમ્ટમ્સ અવેલેબલ છે, ફિઝિકલ જનરલ્સ અવેલેબલ છે, અને વી ફોરગેટ ધેટ એન્ડ વી રન ફોર એન એનાલિસિસ ઇવેલ્યુએશન ઓફ માઇન્ડ. This is fancy. That is good. There is nothing wrong in that. Perfectly needed. But are we sure about the disease, what we say, a dynamic disease which the patient is suffering, what we have seen in seminars? My intention in this, to ask Praveen sir, is to show all kinds of cases are there. All kinds of cases where analysis, evaluation, understanding mind, interpreting mind, analysis is a very fabulous aspect. And it is a fancy, that's what called Bombay method. It's a fancy, that's good, there's nothing wrong in that. But before that, at least have a fundamental understanding of basic homeopathy, the source books of homeopathy. Don't forget the organon, the fundamental principles and the repertory and the principles of various repertorization methods. So, હું હંમેશા એવું કહું છું, આમાં એક મેથડ એવું પણ છે ક્વેશ્ચન. How many methods are there in use of predictive, sensational, so many methods, one best for homeopathy? How can you say that one method is best than others? It is like, if I am practicing sensation method, I say sensation method is the best. If somebody is practicing predictive, that is best. What I have understood in my early years, when I came out, that time also that was the query and questions for me. I studied all the methods, irrespective of the biases. That is what Master Hahnemann says, especially about the rediscovery method, what Dr. Sehgal used to say. And I studied his whole volumes. And what it is said, it says present, predominant and persisting mental symptoms. And he prescribed only on mind, right? For me, it is nothing but an Bonning-Hussein's method of prescription. It's a mental concomitant. If at all it produces result, it is a Bonning-Hussein's method of concomitant. Mental concomitant and physical illness carries a very high weightage. If you are able to identify the individualizing symptom, it's a right method. Predictive, you identify the physical generals, characteristics. These are all ultimately trying to exemplify, simplify for your learning. અને સિમ્પ્લિફાઈ કરવામાં કોમ્પ્લિકેટેડ ન થાય જોવાનું. Just it does not attach you and you just forget the grounds of prescribing. Thermal state બહુ predominant તમારી પાસે એકદમ extensive hot છે. And if you find out some analytical understanding and having a chilly remedy in front of you, so what will you do? If predominantly hot patient, extremely hot, C4 or CH4, and Hipparself comes in your understanding of analysis, will you do? Sir, my question to you. Tiwari sir.
One thing, please keep in mind, this is my understanding, there is only one method, that is Hahnemannian method. If you go through the homeopathic philosophy and homeopathic books, or earlier stalwarts, sometimes they followed Hahnemann, but with some modification sometimes. But think of Kane, Stuart Close, Roberts, Hahnemann. If you study thoroughly, you will get all the answers. Because emphasis of mental symptoms, this is also Hahnemannian concept. This is nothing new. Whatever you are saying that is new. No. Emphasis on mentals, if it is uncommon. If don't get the mental symptoms, go for physical generals, which is uncommon. If you don't get the physical general, go for particulars, uncommon particulars. If you go through the evaluation of Dr. Kent, he described particular that is modified by modalities, then uncommon particulars, and then no particulars. So if you go through, everything is in your book. So try to learn Hahnemannian homeopathy, go through the philosophy, apply it through repertory, through Metria Medica, you will get the result. Because the basis of everything is homeopathic philosophy and organon. Apply it through Metria Medica, through repertory, you will get the result. So nothing to be worried. Follow the books, you will get definite results and success in homeopathy.
Yeah, I have to say something. See, in homeopathy, all the prescriptions are based on the similarity. Law of similia is the main thing in homeopathy. And the level of similarity will tell you what is the result. Suppose you have taken a case and you find the similarity level at the mind, similarity level at the particulars, at the physicals, there is a complete similarity. You select a medicine and you will find there is a complete change and it will produce cure. But if the level of similarity is only at the pathology, suppose you have got a case of piles and there is a severe burning and you find there is a lot of pain remains for some time, you have given a tania. The patient feels better, but that day only or next day only, again it comes. So level of similarity, if it is just pathological, it will give palliation. If the level of similarity is at particular level, it will give relief only at a particular level. So level of similarity always helps you to select the medicine, to select the doses, to repetition, and also it tells you the outcome. Complete level of similarity will give you cure and potency. So what happens is, similia is the main principle of homeopathy. You have extended at different levels and by many stalwarts, but basis is law of similia. अभी जितने आप predictive देखते हैं और ये जितने लोग हैं, हम नाम नहीं लेना चाहते, everyone is based on law of similars. बिना totality के वो देते हैं क्या? अब चाहे वो dreams का ले लें, चाहे वो delusions का ले लें, लेकिन उनका basis है there is a totality. Whatever happens in the nature, always there is totality. So disease is one natural phenomena. There has to be some totality. You cannot say that if there are no symptoms, what to do? If there are no symptoms, you have to find out. Your case again is not proper. Because nature has similarity at each level. अभी हमको कैसे मालूम होता है कि सुबह हो गया, morning हो गई? Morning has a totality. Evening has a totality. बिना उसके आप नहीं जानते हैं कि सन राइज करेगा, चिड़िया बोलेगी, फूल खिलेंगे, ये सुबह है. So like that, every phenomena of the nature, including disease, health, there has to be a totality, and you have to find out totality as physician. Totality मिल गया, तो similarity in mathematics is automatically coming, and your cure has to come. Either cure or palliation. यार in between थोड़ा relief चलेगा. लेकिन there has to be effect if it is based on law of similar. अब आप जिस तरह का रिजल्ट चाहते हैं उस तरह का काम करें. केवल पैलिएशन चाहते हैं तो एक दो सिम्टम दे देते हो, टिंक्चर दे देते हो, 5 दिन के लिए पेशेंट ठीक रहता है. बीपी का पेशेंट आ गया, रॉल्फिया दे दिया, 2 दिन में ठीक हो जाता है, फिर प्रेशर बढ़ेगा. अनलेस यू गिव ए कॉन्स्टिट्यूशनल रेमेडी. तो इट डिपेंड्स ऑन हाउ यू टेक द केस, हाउ यू सी द पेशेंट एंड हाउ यू फाइंड आउट द मेडिसिन. If everything is in your hand, you are a physician, remember your responsibility.
Wonderfully
Here,
said. Wonderfully said.
I would like to add one thing. All of you may be aware, there is one beautiful shloka. Should I stop when you clap? Okay. There is one first shloka in Bhagavad Gita. Advaitamruta varshinim bhagavatim ashtadashadhyayanim Tvam anusandadhami Bhagavad Gita bhavadveshinim. Let us forget all that shloka. I am not Sadguru teaching you Bhagavad Gita. But take that Advaitamruta Varshinim. Actually, this Bhagavad Gita, Adi Shankara, he narrated, said Advaita. Advaita means there is no duality.
No duality.
Atma and Paramatma are same. That is Adi Shankara's teaching. After some time, Madhvacharya, who is very famous in Kannada area and all that, he was also a realized soul. He took the same shloka and said, Dvaitamruta Varshin. The whole shloka is same. But he said, means that. Dvaitamruta means double. He never accepted Atma as the same like Paramatma. Both of them reached heaven. Both of them are treated as gods because their goal, their aim was the same, to reach the God. Similarly, as Dr. Tiwari said, whatever might be the method, sensational, numbness, tingling, any methods or predictive, unpredictive, anything, whatever you have procedures, all of them have to be based on our organon principles to arrive at a simillimum or similar remedy to attain some desired result. So don't get carried away by these methods. Learn, listen, apply in each type of case, because the case needs an approach which is its unique nature. It cannot be already stereotyped. So you be equipped with all types. Then you can apply in every respective case. Thank you.
Thank you.
You raised a question earlier
That's a...
that if one case is being treated by 4 homeopathic physicians, they will give 4 different medicines.
you said. All the 4 are showing different remedies.
Yes,
Sir said.
but that is, the reason is there, it is also answered in the organon, all are partial similar medicines. You see, this is a totality. You are giving a particular drug which is partially similar to some of the symptoms. You see, a newcomer also practicing homeopathy and they are also earning money because they are partially similar medicine that is improved, then go for another medicine, and ultimately cure. So that partially similar medicine takes a long time to cure a disease. Whereas an expert can get the medicine, right medicine, similar or similarium, to cure completely within a short time. The ideal of cure is the shortest time. If you give different medicine at different time, that will take a long time to cure. But if you give a medicine which can cover the whole, that can cure number one. And that is like that of a perception of a old person in an elephant. Suppose if you touch the leg, you will say this is like a thumb.
A story of an elephant.
Yes. Or if you touch the...
if you touch
like
the...
yes. So like that, you are looking only the parts of a particular whole.
So, all in all, just cut it because we are running short of time. The magic mantra is simillimum.
Yes, yes.
The one magic mantra is simillimum by any methods or modes. If you are able to find out the similarity at levels, it has an ability to transform. It has an ability to revert the process also. And we have seen in a number of cases some magical cures. But we cannot claim in every cases we can create this because we are not sure of the pathological processes, we are not sure of the totalities, we are not sure of the medicines also. Because clinical diagnosis, I really appreciate Praveen Kumar sir, in emergency cases, first diagnose. We forget that. Why? Ultimately, we are doctors. We need to diagnose. The first and foremost, the first aphorism Dr. Das sir has showed, the physician high only mission is to cure the sick and restore him to health as it is termed. So life bachana hai, and this is a wonderful session. I thank you very much all the speakers, and we are concluding this session because we have almost 15 minutes, 20 minutes reached beyond the time. આપણી પાસે હજી 10-15 મિનિટ છે પણ બિફોર દેટ વી વિલ હેવ અ નેશનલ એન્થમ અને પછી જે લોકો શહેરની સાથે ઘણાને ફોટોગ્રાફ પડાવવા છે મેમેન્ટો સરને આપણે ફેસિલિટેટ કરીએ દે કેમ ઓલ ધ વે ફ્રોમ ધેર યા
Thank you all for joining us for panel discussion. Now we are going to distribute feedback forms. So please spare a minute and give your genuine feedback and return it to our volunteers.
This is a custom actually. તમને feedback form આપ્યું છે ને because again we need to listen to you. Whatever we feel appropriate, we try to make that possible. But I don't know what exactly is passing through. If your feedback is my listening to your voice. So in future also, we have raised 3 કે 4 કે 5 જ સવાલ પૂછ્યા છે. પણ ઓનેસ્ટલી આપો તમારી જાતને, તમને જે સારું લાગ્યું, ખરાબ લાગ્યું, ઓકે લાગ્યું, નહીં ઓકે લાગ્યું, વોટ યુ વુડ લાઈક, એટલીસ્ટ સમ મોમેન્ટમ શુડ બી ધેર. કંઈક મોમેન્ટ હોવી જોઈએ ને, બિકોઝ વી હેવ લોસ્ટ ધ મોમેન્ટ. અમે ખાલી 15 જણા હતા ત્યારે ખૂબ મોમેન્ટમ હતી. And now with these 12 colleges and almost 2,000 homeopathic doctors, no moments. So it should not be that. Thank you.
Now I like...
One minute. Actually, there was one discussion. 4 homeopathic doctors gave 4 different prescriptions. But in the archives, if you go back to Hahnemann's history, you would agree with me. Once Hahnemann visits one wine shop on his way, and when he goes there, he sees the person who was selling the wine, and he recognizes him and says, "Why are you sick? You are not looking normal." He tells, "Forget it, yaar. Kya hona hai wo bolo." So he asks out of curiosity. Then that conversation goes a little ahead, and then he says, "I have a sickness. I have certain symptoms, and I went to a doctor. He gave me the prescription." He had a register also. First prescription. All were allopathic doctors, 8 prescriptions. All allopathic doctors, 8 different prescriptions. Then Hahnemann says, "I'll give you the prescription because you told me the case history. Write the same case history to homeopathic doctors whose addresses I'll give you. And if you happen to get same prescription, then take homeopathic medicine." And this wine seller, he gets back the answer from other homeopaths who prescribed same remedy like Hahnemann, and he used and he was cured of it. It is written in the books. So it happened because there were 2 reasons. All of them followed Hahnemann's principles strictly. Second, there were very few drugs. Less luggage, more comfort. Very easy. So that is there in the archives. You can read it. Refer to links archives, you will get that story.
Literatures, how many of you knows that there are books called lesser writings? કેટલાને ખબર છે? હાથ ઊંચો કરો. Lesser writings of Master Hahnemann, Master Kent, and you find out their own literatures. They have spoken, ક્યાંક વાત થઈ હોય, ક્યાંક discussion થયું હોય, and their small article published કર્યો હોય. You tend to understand their mindset, what they have gone through during that process of developing the science. And it's a wonderful books, collection of archives. So old literature are gold mines, old mines. Just go for it. રોજ કંઈક ને કંઈક નવું વાંચો, you will be nourished. I invite after this, I think મજા આવી? સવારે નાસ્તાથી લઈને બપોરના ડાન્સ સુધી એમાં વધારે મજા આવી. સો આ આખા દિવસનો જે સરસ મજાનો પ્રોગ્રામ થયો એના પાછળમાં જે લોકોએ કામ કર્યું છે એ લોકોને બોલાવવા જોઈએ ને, અહીંયા એપ્રિશિએટ કરવા જોઈએ ને. તમે સરસ રીતે મહેનત. આવી જાઓ બધા પ્લીઝ. કમ ઓન ધ સ્ટેજ. અરવા મેડમ ને બધા. હા, આપણે મોમેન્ટો પછી આપીએ ને. પહેલાં તમે આવી જાઓ. કમ ફોરવર્ડ. આવી જાઓ ઉપર બધા. અને તમારા હાથે જ મોમેન્ટો અપાવી. આવો. અરવા મેડમ આવો. ગુંજા મેડમ આવી જાઓ. પથિક સર આइए ऊपर आइए. We welcome the distinguished speakers with a special memento. I call upon the team to present a memento to Dr. Praveen Kumar sir. आओ બધા સાથે આવો. 3-4 જણા આવી જાઓ બધા સાથે. Come forward. Come. These are the team sir. I said કે this is a litmus test for leadership. મેં બહુ ઓછું કામ કર્યું છે. 10 દિવસ 12 દિવસમાં I did a very little work. Please. આવો, હજી બીજા છે ને, બીજામાં લેશો. આવો તમે. Come forward. આવી જાઓ. Come forward. કામમાં આગળ જો ને, આમાં પણ આગળ આવી જાઓ. થેન્ક યુ સર. પૂરી મેડમ આવી જાઓ ઉપર. આવો. દીપાલી મેડમ. હું કેટલા જાણું. અંકિતા આર્યવીરમાંથી રિંકુ સર ને બધા ક્યાં છે? આ જાઓ. नेक्स्ट बीजी टीम डॉक्टर अशोक कुमार दास आ जाओ आइए सर आओ टीम जल्दी मारे बोलो वेलकम करो अपने कम फॉरवर्ड रिंकू सर आ जाइए वॉलंटियर्स ने नाम न देવું પડે આવી જાઓ તમે બોલાવી લ્યો છે કમ ફોરવર્ડ આવી જાઓ वेलकम सर अरे मैं हूं ना साथ में ही हूँ आइए 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 सर्टिफिकेट नीचे रखिए आपका दिखता है पेमेंट नीचे रखिए सर्टिफिकेट हाँ ये है दिस इज होमियो सेमिनार थैंक यू डॉक्टर शशिकांत तिवारी सर प्लीज कम स्टूडेंट वॉलंटियर्स क्या है આવી જાઓ બધા ફટાફટ આવી જાઓ કામ કરોડા વિરોધ ને બધા आ जाओ भैया ओम ने रात्रे 1:30 वाग्या सुधी काम कर्યું આવી જાઓ જલ્દી ફટાફટ તમારી ટીમ આવી જાઓ તો દઈ દે કોકને બીજાને પાડી દેશે તું આવી જા તમે બોલાવી લ્યો તમારી ટીમમાં જે હોય બોલાવ્યો ફટાફટ આવી જાઓ હાલો જલ્દી प्रोएक्टिव लीडर से सब अपने आइए सर आ जाइए आओ आगड़ हाँ आगड़ आओ આવી જાઓ બેટા સર્ટિફિકેટ ले लो तू ले ले बेटा तू ले આવી जा तू जे मैं हूँ यस आकाश बाकी है आई जा कोई भूलाई जाए तो बोलाई ले जा भाई नीरज फटाफट આવી જાવ હાલો જલ્દી આમંત્રણ નથી આપવામાં આવે આવી જાવ હાલો જલ્દી બધા ઉભા રહ્યો સ્પીકર આવી જાવ હાલો તમે બધા આવી જાઓ प्रवीण कुमार सर आ जाइए दास सर आ जाइए अभी जाओ द होल टीम दोज हु हैव ऑर्गेनाइज एंड टेकन पार्ट अभिनव आ जाओ हाँ सब साथ में राजू सर आ जाओ आर्यवीर वॉलंटियर्स तुलसी मैडम श्रुति मैडम आ जाओ चलो वंडरफुल आगे नीचे बैस जाओ આવી જાઓ સરસ આવી જાશો આવી જાઓ બેટા આવી જાઓ સાડીમાં કેમ બેસું કા એટલે રાજી છો કે નથી તમે આટલો સરસ પ્રોગ્રામ કર્યો હે ને તો 3 cheers ફોર સક્સેસ હિપ 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 ગ્રેટ ટેક એ ફોટોગ્રાફ We'll raise for the national anthem.
I request Dr. Shashikant Tiwari sir, Ashok Kumar Das sir and Dr. Praveen Kumar sir to please present a memento to our very dear Dr. Kalpit Sanghvi sir. let's have a great round of applause. As we are proceeding to the end of this day, I would like to thank each and every one of you being present here till the end and making this day a very special one. All of you, please fill the feedback form, and on submission of the feedback form along with your conference kit and the ID card, you will receive a kit. So feedback form submission is compulsory, and all students of HNS and AV, third year, fourth year, second year and interns, please be seated in the seminar hall after the national anthem. Your kits distribution will be done here. I request now each one of you to please stand for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
The high tea will be served on the first floor of the auditorium, not where the breakfast and the lunch was. So